Hi everyone, welcome to Dr. Harry's Healthy Corner, and I am Dr. Harry. Today it's Wednesday at 7:30, and today I wanted to talk to you about fibromyalgia. For those of you who don't know me, I'm Dr. Harry, and I am board certified in holistic integrative medicine and emergency medicine. And I like to combine all of those things, integrate them all to help you live a healthier lifestyle. So today I wanted to talk about fibromyalgia. Why did I choose fibromyalgia? Well, I've had several requests during my Facebook live talks about fibromyalgia. And I feel that means that, to me, that many of you out there know someone, or you yourself are being challenged with this sometimes really difficult to diagnose condition. And if you know someone who is, you know how much and how debilitating this condition can be at times. Yes, there are times when there are good days, but also there are many times when you have bad days. So let's talk a little bit about fibromyalgia. We'll talk about what is fibromyalgia, who is at risk for it, and of course, is there a cure, or is there anything that we can do to help ourselves feel better? So what is fibromyalgia? Well, fibromyalgia is characterized primarily by widespread pain. And that means, by widespread pain, what we mean by that is that the pain crosses both sides of the body and is above and below the waist. And usually the pain is described by many as a dull ache that's felt deep in the muscles and sometimes even in the bone, and at times can be very debilitating. But not only is it characterized by pain, it's also characterized by disturbances in sleep, memory disorders. And so sometimes the foggy thinking that happens with fibromyalgia almost might lead the individual to think that they might even be developing early stages of dementia. And also there might be mood issues as well, and anxiety, depression can also accompany this, as well as irritable bowel syndrome symptoms, TMJ pain, and sometimes even headaches. So as you see, it's really a components of symptoms in fibromyalgia. So what is thought to be happening in fibromyalgia? Well, that's interesting. We don't have the exact answers yet, but here are some theories that I think that you will find very helpful, because it helps us when we are trying to help treat these symptoms. So what's thought to be happening is that it's thought to actually affect the way the brain processes pain. And so the brain receptors become hypersensitive to pain, and they tend to overreact to pain. So that's one thing that's happening. The other thing that's thought to happen is that there's a great demand for energy, and it exceeds the body's ability to meet that demand, and so it's thought that we blow a fuse. Now, for those of you who are familiar with circuits, you know when you blow a fuse, you've got to reset it or turn it back on in order for things to be functioning normally again. The problem with fibromyalgia is that the fuse, we're not able to turn that fuse back on. And so energy starts getting depleted, especially energy levels in the muscles. And so the muscles start starving for energy, and they might respond by shortening and spasming, thus increasing the pain. So you have a couple of things happening here with the pain. The brain is oversensitized to pain. The brain pain receptors are oversensitized to pain. And you also have the muscles responding to an energy depletion as well. And this can cause the pain cascade to go awry. Other changes are thought to be happening in the brain as well. The parts of the brain that gets impacted is actually part of the brain that deals with temperature regulation, hormonal regulation, and so those things start getting impacted, and so then we start experiencing neurotransmitter levels starts going off, so we start experiencing anxiety, we start experiencing depression, we start experiencing fatigue, and we start experiencing issues with sleep. And then those things tend to fuel each other, and on and on and on we go. So you can start to see the issues that can happen with fibromyalgia. So when we are experiencing this fatigue, the fatigue is, imagine you've gotten a good night's sleep and you wake up, but you're still just absolutely exhausted. That is the kind of fatigue that we're talking about. It's like feeling that you're walking underwater. You're really not able to, sometimes individuals feel as if they're really not able to put one foot in front of the other. And that can be a very debilitating type of fatigue. And so these individuals then started experiencing all of these issues. So what can be some of the triggers for fibromyalgia? Well, remember we said it feels like there is a huge demand for energy in the body, and the body does not have the supply for it, so there's a circuit, there's a fuse that's blown. So some big traumas can sometimes trigger fibromyalgia. So traumas like surgery or infections or big psychological traumas can trigger fibromyalgia. But sometimes fibromyalgia happens very gradually and there's not one particular triggering event. So as you can see, again, we're still trying to sort through as to the exact cause of fibromyalgia. But in the interim, our goal is to try to replenish the energy, decrease the pain, return some of the vitality, because life is really meant to be lived to its fullest. So how are some of the ways that we can do this? Well, traditionally there's some ways that we do this, and then integratively there's some ways that we do this as well. So I wanted to talk about both ways that this can happen. So traditionally, of course, we want to be able to treat the pain, and it is oftentimes, and certain types of antidepressants are used to treat the pain and the fatigue symptoms. So oftentimes if you go to your physician, and he or she might suggest an antidepressive such as one that's called Cymbalta. And then this is taught that to treat pain as well as perhaps return some of your energy levels as well. And of course the pain is also, because remember we said the muscles are spasming a little bit, so then oftentimes muscle relaxants are used in this case scenario, and they may also help you to sleep, because sometimes you're not able to sleep because of the pain syndrome. And so sometimes that you're able to get some sleep by using muscle relaxants, and so you will see muscle relaxants being used as well. And sometimes anti-seizure medicines such as Neurontin are used to treat pain and sleep, and then small amounts of antidepressant medicines as well can also be used for sleep. Some people actually put on sleep aids to help with sleep, because we know if you're not able to sleep well, then any symptoms that you're experiencing absolutely become significantly worse. So, and a practice that treats fibromyalgia also recognizes that sometimes individuals need to go through physical therapy so that they can learn some exercises that wouldn't exhaust them. Because part of the issue with fibromyalgia is that even any type of exercise can absolutely leave you feeling worse, but you don't want to avoid all activity, because that can also make you feel worse. And sometimes a well-rounded practice will put massage therapy in there, and may even suggest things such as yoga and Tai Chi to help with relaxation and stress management, because stress will absolutely exacerbate any symptoms of fibromyalgia. Hi Latina, hi Wendy. So how do we approach fibromyalgia in an integrative way? Well, very similarly to a traditional way, but we sort of go through the process a little bit differently. So initially, of course, we want you to be able to sleep well. So we address sleep first, because without sleep, nothing gets better, inflammation gets worse, pain gets worse, fatigue gets worse. So we know that we need to start intervening in that aspect. How we may be similar is that we may use some of the same medications in this case, or we may also start off with some supplemental medications that can help with muscle relaxation as well. So some things that we might use as muscle relaxations, and again, this is a very short talk. We can't possibly include everything about fibromyalgia. If you have particular questions, definitely jump in and ask those questions, because I will make sure that those questions get addressed in this segment. So some of the things that we can use for muscle relaxation and sleep might include, for example, passion flower or L-theanine, calcium, magnesium. Those are some of the things. But we also may consider using things like Neurontin and muscle relaxants as well, because the key thing is to get you to sleep. And once we're able to get your sleep going, then we can treat other symptoms. Keep in mind, with fibromyalgia, this is also, we need to make sure that there's nothing else going on. So we want to make sure that your thyroid is functioning normally. We want to make sure that perhaps you're not suffering from anemia, some other type of autoimmune diseases. And so those things will be looked at. So some blood work will be done to make sure that you're not suffering from any of those diseases. We also want to make sure that you don't have any underlying low-grade infections that could be impacting how you feel. And so those things will also be looked at as well. Remember, we said that part of the fibromyalgia syndrome is that the brain is not, there are parts of the brain that are not functioning as well and are not quite as online. And so part of that might be what we call the hypothalamus, and that part does control a lot of the body's systems, which include the adrenal glands. It controls the thyroid, and so those are all things that we look into to make sure that those are nice and strong and healthy, so that you can return to normal functioning. So then what we're talking about here is that there's some hormonal issues that can contribute. And so oftentimes when we look at hormonal issues, for example, we may say, you know what, your thyroid looks normal or falls within the normal range, and your stress level, stress hormonal levels look normal or fall within the normal range. And so what we have to keep in mind that there's what I believe that there's a normal range, of course, and then there's an optimal range in which each of us function normally. So think of it this way. So let's talk about shoe size, for example. If we're talking about things that fall within the normal range, you can say, normal ranges of shoe sizes, let's say, are from 5 to 12. But let's say you wear a size 7, and somebody then gives you a 9 because a 9 falls within the normal range, and that's not going to fit you so well. So it's obvious, it's something similar to that. So we want to find the range that you are optimal. So sometimes your range might fall within the normal range, but it may not be optimal for you, and that's some of the things that we look at integratively to help to optimize the way your body functions, the way your energy system kicks back into gear, the way those energy cells tend to, because those energy cells tend to get compromised with fibromyalgia. All the energy levels are used up, but remember, you've blown a fuse, so a lot of things are used up. So then the idea is replenishing them so the pain can be less. So once we've looked at that, then we want to see, again, like we talked about, if there's underlying infections. For those of us, for example, if I have chronic low-grade sinusitis or things like that, there might be, for those of us with irritable bowel symptoms, is there an imbalance in the GI tract that's causing this, an imbalance of bacteria, the good versus the, quote, bad bacteria? Is that something that we need to look at and to get in order for you to be able to function normally? And then we look at, is there a nutritional imbalance? Again, let's talk about normal. For example, one of the key things, we know that, for example, vitamin B12 is important for energy conversion along with the other Bs. And there's a huge, massive range of normal. In my practice, what I have found is that even though there's a huge, massive range of normal, below a certain number, most people do not function well and do not seem to have the energy that they should have. And so we look at nutritional deficiencies as well. Some common ones that you might find in fibromyalgia might be insufficiencies in, again, the B vitamins that help to convert energy. You might find an insufficiency in L-carnitine, for example, that helps to convert fat into energy. You might find insufficiency in calcium and magnesium, and that would make the muscles spasm even more or hurt even more. You might find a vitamin D insufficiency. So those are some common ones that you may find, but it can vary depending on the individual, and those ones must be replaced in order for things to go well. So while on the traditional side we may be doing those things, and they're not again, it's not incorrect to do those things, because there are certain things that have been shown to help and even approved for treatment of fibromyalgia. I believe Lyrica is one that's been approved for treatment of fibromyalgia. Again, you want to be able to find out if there's some underlying disturbances that are not making those things work as well as they should, or sometimes maybe you may not at some point be able to get off it. You really want to reset the fuse, in other words, right? And so those are some of the things that you can do to reset the fuse. And then we want to talk about exercise, because even though excessive exercise can make us feel worse, those of us who suffer from fibromyalgia, we have to pace ourselves, and we do have to keep moving, and we do have to keep active. And so we want to find activities that helps us to kind of restore and rejuvenate. And that's why I would suggest usually things like Tai Chi and yoga and exercise, water exercises that are easy. And then when you don't overexert, that is the key. If you feel absolutely horrible the next day, you've done too much. On your good days, don't overexert either, because again, you'll be setting yourself up. So it's finding that right type of an amount of exercise that as you get better, your tolerance for exercise will get better. Okay, and then of course we want to control the pain. And so in controlling the pain, again, we may choose some things that people would call traditional. And again, I tend not to differentiate, because being trained in both, I like to have the ability to use both things depending on what the person is comfortable with and what I feel, after discussing with the patient, would have the least amount of side effects, right? And finally, I wanted to say that there seems to be a psychological profile with people with fibromyalgia, and that's our type A perfectionist personalities. And those of us who seem to have issues with boundaries and being able to say no, because you need now at this point to really establish boundaries and be able to take care of yourself and be able to say, be able to say no, I am not able to do that right now because I'm in the process of resetting my fuse. And I'm sure many of you are very familiar with that. I am as well. That type A personality and that perfectionism sometimes can cause significant problems for us. So that is fibromyalgia, just wrapped up in a small little nutshell. I know there's so much more to know about it. But I hopefully this answered some of your questions. I'm going to take some time now and see if there are any questions that you had that we can look at and answer any of those questions for you, and say hi to everyone. So hi Latina and Wendy, and hi Mary. It's so good to see you. And let's see here. So let's see, we've got some comments here, and let's see what questions. Do we have any questions? Okay, don't see any questions here, but let's just hi everyone who's checked on so far. And please, if you have any questions, love you too, Mary. You are the best as well. Okay, here we go. What are some natural pain reliefs? That's a very good question. And this question comes from Wendy. Some natural pain relief. So boswellia, that's a really good one. And some people do, if you have, and willow bark, if you have an allergy to aspirin, then please don't, or an allergy to any of those things, please don't do that. Muscle relaxing things as well. You combine those with perhaps passion flower, also has some muscle relaxation and pain relief kind of properties. Again, they take time to start working. Okay, so you will take, depending on the dosages, about anywhere from about 1 to 3 times daily, and about 4 to 6 weeks, and you might start noticing some pain relief with that. It's important as well to, if you've got a significant magnesium or vitamin D deficiency, those need to be replaced as well. So those are some over-the-counter things that you can use. Anti-inflammatories help some, and then by that I mean Advils, but oftentimes, again, the amount that you have to take may cause some stomach distress. So you can talk to your doctor about other pain things, like perhaps Ultram, and like I said, some people do use Cymbalta as well, but over-the-counter wise, I like Boswellia. So let's see, is there any other question? Thank you. Any other questions, please feel free to ask them. And I guess if I've been that good at explaining everything and you don't have any questions, then next week I think I want to, I will be thinking about talking about hair, and how to healthy hair and how to keep that going, and just how to accept whatever type of hair you have and just make it work for you. So let's see. Here's a question. And of course, changing your diet and exercising, like Latina mentioned, is important because some people have issues with certain foods that can exacerbate pain. For example, if you're having significant amount of pain, I usually ask you to reduce your sugar intake, as this can be potentially inflammatory. And also, there's sometimes that, for example, tomatoes and potatoes and those kind of things can trigger some pain symptoms in some susceptible individuals. Increase your nutrition is absolutely super huge here. You've got to increase your antioxidants and your phytonutrients, and by that I mean eat your vegetables. Are really important. So use some anti-inflammatory herbs as well. So here's where you might start sprinkling some turmeric, some rosemary, those kind of things. And exercising, like Latina is saying here, is very, very important. And so you're able to sleep better, you're able to have less pain. And I'm so glad, Latina, that some of those things have been working for you that we've been talking about. So as you see, when we put all of these things together, it really, really can help. Let's see. So dietary suggestions. Yes, so smoothies are good place to start, and I'll tell you why. Because you can combine so many things in a smoothie that you need, while you would have such difficulty eating all of those. So here's where you can go crazy by putting the berries and the greens in the smoothie. You would need some nutrients in there, Wendy. For example, you consider putting a little bit of D-ribose in your smoothie as well. That blends up really well, and that supplies some nutrients. You want to get good essential amino acids. Initially, when you're in a really particular flare-up of fibromyalgia, you might want to use essential amino acids. When you're doing well, you can use a complete protein source. If you're sensitive to whey protein, then use a vegetable protein source, because the muscles really need to be fed well. And so smoothies are really good. You check out some of my smoothie recipes. I think those are a really good place to start. The dietary suggestions is what I talk about, really eliminating sugars, refined carbohydrates, processed foods, because those really are potentially inflammatory. And really see if you might be one of those people who are sensitive to the nightshade, a group of foods such as tomatoes, potatoes, eggplants, bell peppers. Some people are sensitive to that and find that their pain does improve when they eliminate those foods. Again, it doesn't apply to everyone across the board, but it is something to try. Yes, Latina, sugar is a key factor. It absolutely is. In most cases. So yeah, you very good advice. Cut out the sugar as much as possible, and absolutely your body will appreciate it, because you will start feeling so much better, and your body can start using, other things for fuel. You need good essential fatty acids that can soothe the inflammation and calm the inflammation down. So those are the type of things that you're thinking about when you're doing your diet, and as you will see, it will slowly start improving. And as with Latina, who shares with us that she was able to get off some of the medications she was on for her fibromyalgia by really like changing her diet and investing in some of those things and exercising. These are things that can happen to you as well when you start gradually making one change at a time as you can. Okay, so the idea is not to stress yourself out and keep that fuse blown, but to really start making one change at a time to replenish yourself and be able to reset your whole body's system. So, hi Nadine. Yes. So, really good questions, Wendy, Latina, thank you so much for sharing your experiences with us. I'm sure it will help many others to know that making some of these changes really does help to improve some of your symptoms. So if you have no further questions, I will say, yes, Tina, it does get easier. And actually, the better you feel, the more encouraged you are to continue. And when your energy starts returning and your pain starts decreasing and you start sleeping better, it feels so much better that you never want to go back. And sometimes we all slip up because we are all human beings, of course, so we do. But when we do, it sometimes feels so bad for us initially that we quickly learn the foods that we need to stay away from to help us to feel better. So oftentimes I tell people actually being healthy, it's really about feeling better. It's not about weight. I a while ago I've stopped focusing on weight because weight really tells me nothing about you and how your body is feeling. So all of these changes that you're making is making you feel better. Look at those success markers like Latina has looked at, like her pain is getting better. And when you sleep, your moods also get better as well. So hopefully this has offered some answers to you, and perhaps help you to understand fibromyalgia a little bit better, and certainly, if nothing else, to let you know that there is hope and you can feel better. Sometimes it's a step-by-step, slower process, but do not give up. It is possible to feel better with fibromyalgia. So having said that, thank you so much for joining me, and I will see you next week. Bye-bye.